So good afternoon again, everyone. I'm Dan Worry. I'm the Senior Director of Early Learning at the Hunt Institute in Cary, North Carolina, and we have been delighted to serve as a co-sponsor for this fantastic day. I hope that it has been productive for you. I am going to be moderating our final full panel discussion of the day, which is on restructuring government and programs to meet the needs of families with young children. We'll turn to audience questions here as we have throughout the day here in a little while. So if you have questions for the panel as we go, please do feel free to put them into the comments. And after some opening remarks, we will turn to them. We've got a fantastic panel today, and I want to introduce each of the three of them. First, we have Leanne Cornion. Ms. Cornion is the Director of Cabinet Affairs for Ohio Governor Mike DeWine. In this role, she is focused on coordinating efforts between agencies to improve outcomes in maternal and child health, early childhood education, and foster care. Leanne began her career as an Assistant Attorney General in 2014, and in 2015, she was named as the Director of Children's Initiatives in the Attorney General's office. She was also among Governor-elect Mike DeWine's first cabinet appointments, being named as the Director of the Governor's Children's Initiative in 2018. Next, we have Ross Hunter, who is Secretary of the Washington State Department of Children, Youth, and Families. As Secretary, his focus has been on improving outcomes for all children, and especially on eliminating race and family income as predictors of progress and success for young learners. Prior to this role, Secretary Hunter served as the Director of the Department of Early Learning and as a state representative. He is passionate about investing upstream in proven prevention strategies, using strong data and outcome analysis to administer these programs, and supporting a strong workforce of caregivers and professionals to deliver the services that ensure fewer children experience trauma and more families can build resilience and succeed together. Finally, we are joined by Dr. Elizabeth Cuervo Tilson. Dr. Tilson is North Carolina's State Health Director and Chief Medical Officer for the Department of Health and Human Services here in the state. Through this role, she promotes public health and prevention activities, as well as providing guidance and oversight on a variety of cross-departmental issues, including the opioid epidemic, early childhood, Medicaid transformation, healthy opportunity pilots. She has also been active in many local, state, and national pediatric, public health, and preventative medicine organizations. Before joining DHHS, Dr. Tilson was the medical director of the community care of Wake and Johnston counties and the chief network clinical officer for community care of North Carolina. Panelists, it's fantastic to have all of you with us. Thank you for taking time out of your busy schedule to participate in this conversation. We're going to go ahead and I'll open it up to the panel. I'll begin with sort of a general question that each will respond to. Each of your states has restructured state government to better address the needs of children and families. Tell us a little bit about how and why that restructuring occurred. And Leanne, maybe we can start with you in Ohio.
Sure. Thank you, Dan. It's a pleasure to be with everyone this afternoon. So when Governor DeWine came into office in 2019, he recognized that there was a lack of coordination and collaboration across our children serving agencies to the detriment of kids and families. So in order to align programs, improve outcomes, he signed an executive order just moments after he took office, creating the Governor's Children's Initiative, really with the key priority of coordinating kids programming across state agencies, focusing on advancing policy and innovation in that space. And then ultimately, the overarching goal is to provide better support services to kids and families across the state. So he tasked the Governor's Children's Initiative with working across these 6 state agencies: the Ohio Department of Developmental Disabilities, the Department of Education, the Department of Health, Medicaid, Mental Health and Addiction Services, and Job and Family Services, which is sort of our Health and Human Services agency in Ohio. To really drive policy, we of course have an incredible kids cabinet with directors from each of these agencies But step number one was to form a cross-agency leadership team with director or deputy directors from each of these agencies to really sort of dig into what was going on and make sure that we had leadership, at the very top and then throughout the organizational chart to help drive the governor's priorities. Among those priorities are to increase evidence-based home visiting services for families, ensuring that more Ohio families have access to high-quality childcare, focusing on prevention education in every single classroom, making sure that all of our kids have access to mental health professionals, and then reforming the foster care system. So these have been our North Star throughout this whole process and what we have really strived to achieve over the last 3 years in partnership with our state agencies. Our structure is a little bit different than I think what you'll hear from my counterparts in Washington and North Carolina, in that we have really focused on cross-agency collaboration and coordination. There is no budget vested in the Governor's Office of Children's Initiatives to achieve these priorities. Instead, we really accomplish them through partnerships between agencies and strong coordination and collaboration coming from the governor's office. And I think what is really critical is that the governor has made it incredibly clear that the director of the governor's children's initiatives is his person on kids policy, really placing that trust and that sense of ownership on the director, which has been critical in helping us to drive innovation, drive policy, and move the needle on these key priorities that the governor has identified. So I will stop there.
Leanne, thank you. And Ross, why don't we turn to you for a little overview of what's happening in Washington?
Sure. About 5 years ago, I left the legislature because it's bad for your soul to stay there a long time, particularly if you chair a budget committee, and ran a small agency, the Department of Early Learning. And I guess people liked what I was doing because they decided that my 300-person agency should now encompass foster care, the whole child welfare system, and our juvenile correction system. And there was a lot of stakeholder demand for this. And this chart that you see is why. We did a blue ribbon commission to look into, like, should we combine these? And I don't want to go into all these things in detail, the percentages and stuff. What you really need to see is the circle of all children, and then the circle of Medicaid children, and everything else is really all overlapping. These are all the same children. And what we found was we had multiple agencies that were completely uncoordinated working with families, which drives families out of their mind because they can't figure out who to respond to. And that having a single agency was really, when I saw this slide from our research agency in the presentation in 2015, actually it was probably 2016, I was like, okay, I got it. Now I understand why we wanted to do this, was to really coordinate at the caseworker level, not just at the coordinating level. So I think it's a little different than what we're doing in Ohio. So we did this huge report. We did work with the legislature to get a bill adopted. First year, we were able to pass a bill, which is not typical with legislatures and big structural change. The communities that we serve were also really, I'm not quite ready for that one yet, really demanding that we integrate because they also were really experiencing this multiple agencies poking at it. But they also had some changes. And I saw it in Leanne's slide, you saw reform the child welfare agency. I think you see that on every single reorg ever happening in state government in the human services sector, because it's a really challenging space to run. So we listened to all of those people. We did a year of planning to make this happen. They took me out of my agency directorship, and I got to run a 6-person agency for a year, and all we did was planning. We built shadow teams from the agencies, the pieces of agencies that were coming together into a new agency. We did extensive project management. We did I'm just thinking back on the complexity of these sort of weekly meetings of the march through PERT charts and Gantt charts. And we built a multi-hundred set of relationship agreements between the new agency and the agencies that were coming so that we didn't break any of the IT systems. We didn't break the phone system. People knew where they were going to go. We did a lot of change management work. We spent more money than I would like to in hindsight on change management. I didn't quite know exactly what I wanted to do, and I would have spent it better had I spent it today rather than 5 years ago. But bringing all of those agencies together, and some of the real challenges, should you decide to do this as a state, is to work out how do you make decisions. You have this time period where who's in charge? Am I in charge? Is the governor's office of financial management in charge? Are the previous agencies in charge? And you can wind up with paralysis, or you can wind up with people having fights. And we decided that we were going to have the control fight right up front. That chart you saw is an example of how we decided how to make decisions. It's a complicated flow chart, and there were 10 revisions to the document that described how we were going to do this. The deputy director at the Office of Financial Management and I, she's a good friend. We are still good friends, but we essentially had a bureaucratic knife fight about control. Neither of us won, and I think we came out with an answer in the end that forced us into consensus on decisions and forced decisions to get made. And I think it was the best outcome that we could have had. I would have preferred to completely control this thing and give it back to OFM in 2 years, and probably that would have been a disaster. So this upfront forcing of the decisions really made a difference. The plan, a year of planning, I hated it. It was absolutely worth doing, because we, unlike most of the reorgs that we looked at as examples, we did not have 3 weeks when we couldn't take child welfare emergency calls, or where we couldn't accept new kids into a system, or we couldn't get checks out to childcare providers. We're a $2 billion a year agency, and getting all of those systems to work up front was really critical. We are still working our way of repealing one of those agreements at a time to slowly and carefully separate ourselves from other agencies without leaving parts on the floor. And I'll leave the structural part for that. We did have a really big party when we finished that full year and really came together. We also had, in one of our agencies, we had a closure ceremony. We had a graduation ceremony. And that was remarkably successful in having people get some closure on where they were and becoming part of a new thing. And in hindsight, I wish we had done that in all three component parts as they came into the combined agency. So you have some other questions that we'll get to and do interesting bits there.
Absolutely, Ross. Thank you. And I want to remind all of you that we'll take some questions from you as viewers here in just a few moments. So please, if you have questions for the panelists as we go, please feel free to plug them into the chat. And with that, Dr. Tilson, let's turn to you and hear a little bit about North Carolina.
Terrific. Thank you. And I think you'll hear 3 different states, 3 different ways we went around this, depending on the structure in that state, which is the beauty, I think, of some of our heterogeneity around the country. But I think there are some commonalities. The why is really common amongst the states, that our children and families, we ask them to enter into fragmented systems, and instead there's desire to really have holistic coordinated systems wrapped around families. So it should be our job to create those systems, not the family's job to navigate our quagmire of fragmented systems. So I think that's a commonality of all of our goals, and how we get there, slightly different organizationally as we move from different states. So one of the question was why and how. So this is one of our reasons for why, is that we really wanted to live into our vision for children in North Carolina, as well as the country and the world, I guess, is that we want children that are healthy. We want children that are healthy and thrive in safe, stable, and nurturing families, schools, and communities. That is our vision for our children and families. Next slide. A key piece of this, and the next slide, I'll show you how we organizationally made this happen. But for this to work, you either have the endorsement of the governor, as our Ohio colleague was saying, or you have the strength of a department behind it. But it is really important that this is prioritized and clearly articulated in your strategic plans, in your priorities, for it to have the weight behind it that it needs. So in North Carolina, as part of our strategic plan for overall North Carolina Department of Health and Human Services, you can see in one of our goals specifically to improve child and family well-being of all children, so they have the opportunity to develop to their full potential and thrive. That is in our strategic plan. And then our secretarial priorities are within our strategic plan, even prioritizing within our strategic plan. And so as we thought about coming out of COVID and out of recovery, the three core priorities of the secretary are behavioral health and resiliency. You heard those words as well from our Washington colleague, child and family well-being, and then a strong and inclusive workforce. And there's pieces of our child work that fits all three of those buckets, but really calling out and having the full support in our strategic plan, in our secretary's priorities for this work. So that's really important. You can organize all you want, but if it's not prioritized, it's not going to get any leverage. So that was a key piece. And this is how we are organizing. In North Carolina, we are considered a super agency. So we have one Department of Health and Human Services, we have divisions within that one department. Unlike Ohio, where you heard there was a Department of Medicaid, a Department of Mental Health, all of those are tucked under one department and they are divisions. That gives us more ability to coordinate within our department. Now, that is not to say there are not silos within our divisions, and there are absolutely siloed divisions, but there is great opportunity to really leverage more coordination because we are all under one department and all under one secretary. And as you heard, one of the secretary's key priorities are child and family well-being. So we've done some restructuring, and you can see we're under this purple arrow is our division of child and family well-being. It is a new division that we are continuing to build. We are flying that jet as we're building it, but our division of child and family well-being tucks under our portfolio of opportunity and well-being, which I just love. That portfolio is really what we want, is opportunity and well-being for our people. So we've created a new division, and programmatically, what we are doing is thinking about what are the programs in Division of Public Health, like some of our WIC, some of our food security programs, early intervention programs. What are our programs within our Division of Mental Health? So some of our early childhood or our childhood behavioral health programs, and some of our physical health programs, and our social service programs. We've heard about child welfare as well. So what are those programs that are scattered amongst divisions that are really focused on children? And let's bring those programs together under one division, again, to have coordinated structure around those children. And some of the key pieces that we're focusing in on, at least in the beginning, and we can get to much more of this, is children behavioral health, child welfare transformation, we've heard that, and food security is some of our three big focus that we are working on in a coordinated fashion within the division and across the department. So I'll stop there, and then we can get into more details as we move forward.
Dr. Tilson, thank you so much. I would add, from our perspective at the Hunt Institute, I think this is a trend that we are seeing around the country. We have worked here just in the past year with states including New Mexico, Missouri, Delaware, North Dakota, who are all in sort of on at one point or another on this same journey, looking at sort of restructuring and consolidating for the purpose of making things better for children and families. And I guess that's sort of my next question. We've talked a lot about the kind of why and how of this, but I'm curious to hear your perspectives on what's different for children and families now as a result of these structural reforms that you've made in the state. Do you have a way of measuring that and telling that story? And maybe Ross, could we begin with you?
Sure. Well, I'm going to give you a bunch of numbers that are things we measure, and I'm going to attribute them to the ability that we have to focus on children and the fact that I report to the governor. And so my priorities don't get buried in a bigger agency. The children's priorities are presented to the governor as part of the discussion. They're not balanced at a lower down level, which turns out to be pretty important because kids don't vote. Um, we have a reduction of kids in out-of-home care by 25% since we started the agency. We're halfway to my goal of safely reducing the size of the foster care system by half. It's faster than the pandemic-related trend we're seeing in most states. We have a reduction of kids in out-of-state placements by 89%. We have single digits now, a handful, very small number of kids, all with an actual good reason to be in an out-of-state placement. We have no ability to have oversight over those. And having them close to home is better for them, and it's better. I feel much safer about those kids having them in state, and the families like it a lot better too. We had our first 3 high school graduations in one of our juvenile rehabilitation facilities in over 6 years because we were able to focus on actual educational outcomes for incarcerated youth. And hopefully we'll never see those kids again. We have better funding across the board. We stopped being buried in somebody else's budget, and we have the ability to both petition the governor to be included in his budget. And though this makes the financial management people a little nervous, I have a lot of friends in the legislature and can work that system directly, which is much harder for someone a little lower down in the structure as it is for a member of the executive cabinet. We have a number of structural improvements that we've made, particularly in child welfare. We improved visitation system dramatically to try and take it off of our caseworkers' plates so that kids are actually getting the visits that judges ordered. We have quality improvements in our service delivery. Every single one of our group homes is now an accredited QRTP. For those of you in the child welfare space, you know what that means. We've shifted all of our contracts. We're not there all there, but we're about 2/3 of the way there to performance-based contracts with our external service providers. So we're actively measuring outcomes, quality and outcomes, and how they affect children. We're seeing quality improvements in our childcare system, overall increasing in our rating system. And we have achieved a significant rate increase for vendors because we spent time, frankly, organizing them politically so that we could actually pay people in the nonprofit sector enough so that their children weren't eligible for food stamps, which turns out to be an important thing to not create another generation of kids that hit our system. So we actually made pretty significant changes in outcomes for children as a result of having a new agency.
Ross, I really appreciate it, and I know just looking at the chat how many of our viewers appreciated too your message around the merits of having a singular agency whose mission it is and whose budget request, for example, it is centered around the needs of kids. I think as we've worked around the country, I think I am routinely telling policymakers, there's not a single right way to do this. That lots of states have consolidated agencies, and they have coordinated systems, and they have created new cabinet agencies, and they have consolidated programs within existing agencies. There's lots of different approaches, but boy, I think you hit on maybe one of the most compelling arguments for having a dedicated children's agency, which is that the priorities for children aren't lost within the structure of a larger agency, and maybe aren't competing when it comes to bringing forward a legislative budget request, for example, with other very valid concerns of maybe a larger agency. Leanne, let's turn to you. Talk a little bit about what you're seeing in Ohio in terms of the ways that restructuring that has happened there has impacted children and families.
Sure. So as I mentioned before, a lot of our work focuses on collaboration and coordination across agencies. So we have worked to embed childcare benefits, for example, into our larger Ohio benefits program, where individuals qualify for Medicaid, for cash assistance, for food assistance, to reduce the paperwork burden on families. We have partnered in a very cross-agency way to stand up a brand new Medicaid managed care program for children with complex behavioral health needs called Ohio Rise. That obviously aligns really closely with all of the work our Department of Job and Family Services is doing on the Family First Prevention Services front. We have been able to implement a new maternal infant support program, which has included making evidence-based home visiting services Medicaid reimbursable in the state for the very first time, creating a 12-month presumptive eligibility for moms postpartum. So, we've been able to move the needle in really significant ways for kids and families. And a lot of it is focused on working collaboratively as agencies to achieve the governor's goals. And we're fortunate that all of our cabinet directors are their kids advocates first and foremost. And that's sort of how they came into their roles. So we're lucky that there is that sort of mission alignment at the director level as well. We've been able to do sort of data analytics projects to help when a mom signs up for Medicaid or for cash assistance or for WIC. We have now bugs in our system that kind of ping to say, hey, you might be eligible for these additional services. So a lot of it is just focused on helping to work out those kinks across agencies, where families can kind of fall into those cracks unnecessarily. We also have worked collaboratively as agencies to implement SSIDs across all of our kids serving agencies. So now we can focus on longitudinal data to understand which of our programs are most effective, at what dosage level, and really dig into some of the data and science behind the effectiveness of our programs. So just a few ways that, in 3 short years, we have really been able, 2 of them being in a pandemic, to kind of move the needle for kids and families in Ohio.
Leanne, thank you. Dr. Tilson.
Sure, I'm happy to. And if you'll pardon the pun, I'm jealous of the 3 years. We are in an infancy of our division. We are just standing it up now as we're coming out of that pandemic. But there's a couple things I want to say about some successes, and then also some of the process pieces we're put into place to hopefully then drive to better outcomes for our families. One piece is, you may have missed it, but our division of Medicaid is not getting tucked under this new division, but we are doing an enormous amount of cross-departmental work with Medicaid, because of course Medicaid is exceedingly important to our pregnant women, to our children, to our families. So although it's not tucked under the division, we're having really, really tight lines and really working on having our Medicaid program really improve those outcomes and be very kid and parent friendly. So a couple things that we've also done is extended that 12-month postpartum coverage. We're really excited in North Carolina to have that extended coverage. We are a little bit new in going into Medicaid managed care as well. We haven't even been in Medicaid managed care for a year yet. So we've rolled a lot of things in our standard plans around our moms and babies. We also are working on our tailored plans that'll be for people with much more complex behavioral health pieces, and making sure we have that our children focus on that. And we're also working on standing up a statewide foster care plan, because those children in foster care, they have huge amount of mobility. So trying to make sure we have a plan that works for our foster care children in Medicaid. So those are things we've already been, and the other piece we've been doing is part of our Medicaid transformation to managed care. It was through a mechanism called an 1115 waiver that gave us flexibility on different things. And so part of the flexibility is what was alluded to a little bit earlier, is our Healthy Opportunities pilots, where we've been able to use Medicaid dollars for things that are not currently billable to Medicaid. And we've thought a lot about that for our pregnant women and our children, and inclusive of some of the evidence-based home visiting programs and parenting programs that aren't currently billable to Medicaid, having that be also a billable service within our pilots as well. So really trying to leverage our Medicaid program as much as possible to buy health for our children and families. Now, within the division, some of the things, the infrastructure that we're building to be able to track and measure those outcomes within our child behavioral health, we are building a dashboard specifically around all these key metrics around child behavioral health, so that we know how we're doing and we know where we're falling short, so we can track that. Within our child welfare transformation work, we just pushed out maybe about 2 or 3 weeks ago our first white paper looking at our coordinated action plan specifically for those children with the most complex behavioral health issues that are in our child welfare system, those kids who are boarding in the emergency department, boarding in DSS offices, boarding in hotels, because there's such complex, especially behavioral and physical health. So we have 13 strategies that we, in a cross-departmental way, put together to really promote that children and families in those circumstances. And as Ross will agree with me, that I can tell you my priorities, but really I'll show you my budget, and that person who's looking at my budget will tell you my priorities. So in our budget that we put forward, we'll be putting forward to the governor, you will see this whole package of services around that this coordinated action plan specifically for these children with the most complex behavioral health issues. So that's a first piece, is those children in the biggest crisis. And now we are doing a lot of intentional work, a little bit more upstream in our child welfare system. We're thinking about what is the socioeconomic drivers that we can address to keep families a little bit more stable, hopefully keep those families together, thinking about food and housing and early child education. We are working, a next work group looking specifically at the behavioral health and substance use disorder in our families. And then another group thinking about very targeted, how can we reunify families who have been separated? So that's a chunk of work. And out of that, a series of recommendations and budget asks will be coming as well. We are, as we come out of the pandemic, the other piece that we're focusing in on is older children mental health, especially with school mental health. And so doing work with our partners. One thing I will say in North Carolina, although most of the departments are under the Department of Health and Human Services, the Department of Public Instruction is a different department that is not under DHHS. So that's where we have to do some cross-departmental work. So we're working on that. That'll be a priority, is our school mental health. And then finally, thinking about some concrete ways to think about food security. So our WIC and our school-based food programs are coming in our new division, and then our SNAP and our FNS, which was in our Division of Social Services, is coming also into the division. And so we're doing a lot of intensive data work to say that we can identify someone who is covered by Medicaid. Are they enrolled in WIC? Are they enrolled in SNAP? And then if they're not, then how can we make thinking about the best targeted and coordinated outreach through our managed care plans as well through us, to make sure that everybody who's eligible for these existing programs are enrolled. So that's some of the ways that we are trying to build this plane and fund this plane and coordinate and have good data to track our outcomes as we're on the other end.
That's fantastic. Dr. Gilson, thank you. I can't help but think that anyone listening to this conversation, and certainly anybody looking at the graphics on several of your PowerPoint slides, is missing the fact that this can be incredibly complicated, complex work. And we've talked a little bit about the benefits of restructuring to children and families in your state. But I'm curious to know, and for the benefit of those who may be in the audience who are thinking about their own state structures, what has been the most challenging part of this work? And what, if you had the opportunity to give advice to a state who is maybe looking at undertaking some of the similar kinds of reforms, what advice would you give to them, having lived through these experiences? Leanne, maybe I'll start with you.
Sure. So I had the good fortune of having a very clear set of priorities from our governor coming into this role, which really helped me to partner with our state agencies to focus on implementation. Many of the governor's priorities had clear metrics in them, so that makes it easy to measure against. So I would say, make sure that you understand what your key priorities are it's impossible, maybe except in Ross's case, to be all things to all people. So just know what your priorities are, how you're going to measure success, and make sure that you're constantly reflecting upon them with your agencies, with your staff. That has been really critical, I think, to our success with moving the needle on every single one of the priorities the governor laid out.
Leanne, thank you. Ross, what advice would you offer to your peers across the country?
Well, I would absolutely agree with Leanne's comments about focus. Is you got to know what you want to do and limit all of your distractions. That's a sort of good general management advice for running one of these operations. It's as big as these things are, and you have to be really clear about communicating it. The things that that are really challenging in combining state agencies or rearranging them is, for us, it was, oh my God, we did not get enough administrative support. I had written the story down here to tell you about getting enough attorney general support, about like there's this complicated way that they get budgeted for. We have hundreds and hundreds of assistant attorney generals who do child welfare cases, millions and tens of millions of dollars worth of it. But the allocation formula for it in the agency we were inheriting from only gave us 10% of what we needed. And I finally just stopped blunting my pick on this issue and said, all right, this is going to turn out in the wash, because all those people are going to work on our stuff anyway. We're just going to get billed for it. And it's big enough number that the budget people will have to figure it out. And sure enough, that's how that worked out. But not getting enough HR staff, not getting enough, just like accountants. You got all these pieces of paper. Most of these systems are antediluvian. How do you bring all those things together? You got to make sure you focus on the nuts and bolts of having a functioning agency, as well as if you just focus on that kid outcomes, which I would love to do, like you don't pay your bills or you don't answer the phone. So I would say that was really challenging. We put a lot of work. I think we did a pretty good job of it. It's taken us 3 or 4 years to really squeeze out and really get, I got to have 5 more HR people because I can't hire fast enough. And so those are really challenging. Having someone who's done a big state agency reorg before, be involved in your reorg. The comment one of you made about deputies actually running the world. Oh my God, you have to have a great deputy who really just does details all day, every day. And having someone who's done this before is critical.
Dr. Kilson, what would you add?
Yep, certainly agree with my colleagues very much. The biggest challenge, everybody gets the vision. Everybody gets, yes, we want to have coordinated systems around the family. It's not hard to sell the vision. The devil is in those a million administrative and HR and funding and budget and contracting details. There's a huge devil in those details. Which is surmountable, of course, but there is a huge amount of administrative, and you really have to think about it and write what's the infrastructure that you need, the administrative infrastructure that you need. You have to build the business capabilities in this new division. So there's a huge amount of planning that has to go on behind that. And then including in North Carolina, we are a very decentralized system. So we have 85 local health departments and 100 local departments of social services. And we have contracts with all of them. We have with our local health departments, we have what are called our consolidated agreements or our agreement addenda, where a lot of these services that now we've consolidated out of the Division of Public Health are still delivered by our local health departments. So WICs are typically in our local health department. And so thinking about all these AAs, these addenda agreement, and how the Division of Public Health will have some of them, this new division will have some of them, and intersecting with our local partners, is a spider web of contractual things that we're working through. But that's okay. That's all administrative. But don't underestimate the administrative lift that it takes to get to this vision. But then you need to prioritize and focus and remember people to remember why they're getting to this vision. And so some of the big things is you have to have that consistent leadership, right? If your leadership isn't bought in, you're not gonna get there. Making sure it's prioritized. You have to be sure that you're building in enough business and organizational infrastructure to make this fly. And then change management. So we brought in a change management entity that really could work with all these divisions and in a very thoughtful way, because change management is huge. And Ross, I think you're alluding to a little bit, there is a grief for those who have been in programs or in division, and that closes. There's a grieving process there that I love your the kind of goodbye party or what you were saying, but it's really important. A lot of these programs have deep trenches, and so really important to think about change management in and of itself as you're doing these changes. So those are some key things which I think is reflective of what my colleagues have been saying as well.
Fantastic. We've got just a couple of minutes left before our final presentation of the afternoon. Want to definitely encourage, if you have a last question, feel free to pop it into the chat. Ross, there is a question in the chat from Wanda, which is a good one. He's asking if you might briefly review how you were able to reduce that participation of children in foster care by 50%, and how long did that take?
So I haven't got to 50% yet. That's the goal. We're down 25%. We had about 9,000 children in out-of-home care. When we started, we're below 7,000 in the 6,700 right now. It's lower than it's been since the 80s. There's two ways you reduce the number of kids in foster care. You reduce the entrance rate, or you speed up the length of stay. We've been focused on the front end of that. The pandemic helped because it shut down the schools, which shut down a lot of mandatory reporters. And we're actually not seeing as much of the crazy safety concerns we were all worried about. But we've been working very hard on trying to not have racially imbalanced removal decisions. Our state, like many states, removes more Black children than we do white children per capita. Trying to reduce that, focusing very heavily on American Indian and Alaska Native children. The ratio there has fallen significantly, so trying to be really intentional about removals. To get to the second half of this, we're going to have to shorten our length of stay, which is much too long. We're at about 600 days on average, and it's just way too long.
So a question from Nancy on the screen. She's saying, so much takes place behind the scenes to care and educate little children. We have a Rhodes Scholar from Finland this year, and she's amazed at the complexities of our early childhood system. Should we simplify our system, or is that not a beneficial goal? Anyone care to weigh in?
I think I'm wondering if it means our early childhood education system with the ECE. I'm wondering if that's what that means. Mm-hmm. Yeah. I'll take a little stab at it to start with, and then cede to my folks. So one thing is, so we have our division of child and family well-being, but also under the same assistant secretary is our division of child development and early education. So it's actually a different division, but works really closely with this division and under the same assistant secretary. Yes, I think everything needs to be probably more simple, but even more so, it is woefully underfunded. So our early childhood education systems need to be funded more. Our staff, our early childhood education staff, woefully underpaid. We need to really invest in training and paying and insurance of our early childhood education staff. When we've been in North Carolina, we are not a Medicaid expansion state. And one of our huge workforces who are not insured are our early childhood education workforce. So we need to invest far more in our early childhood education workforce in terms of training, in terms of payment, in terms of insurance, and also in terms of trauma-informed care and teaching. There is just pervasive trauma amongst our whole population, and especially within thinking through our early childhood workforce as well. So just there needs to be, and when we think about it, and as I alluded to some of the three priorities of our secretary, the third one is a strong and inclusive workforce. really thinking about our early childhood education workforce and huge investments in that. We have been able to, we have some federal grants. Our child care stabilization grants has really helped to invest in early childhood education, and we need to do more work on that. So simplify, yes, but massive more investment is needed in early childhood education.
I would quickly say in New Jersey, don't screw up the Abbott preschool stuff. They have a really high quality system they need to expand. And how you manage it is complicated compared to Finland, which just does this stuff with much higher tax base, perhaps not higher than New Jersey, but higher than mine. And so New Jersey system's not super broken. So I'd love to have the Abbott stuff. So.
Well, I hate to say, but our time is up for the session, and we knew it would go by quickly, and certainly has. I want to thank our panelists, Leanne Cornion of Governor Mike DeWine's office in Ohio, Ross Hunter of the Washington State Department of Children, Youth, and Families, and Dr. Betsy Tilson of the North Carolina Department of Health and Human Services.